Hello, everyone. I am F. DuBois Bowman, the 13th president of Morehouse College, and it is my honor to bring greetings on behalf of Morehouse to this important conversation. Ask a D9 Doctor is exactly the kind of programming that our communities need right now. Prior to my return to Morehouse as president, I served as dean of the School of Public Health at the University of Michigan. In this capacity, I had a clear view of the disproportionate health impacts affecting our communities. The leaders of this panel know the data well, and those data reflect an urgent need. Heart disease is the #1 cause of death for Black Americans. And the mortality rate from heart disease for Black Americans is roughly 30% higher than for white Americans. Cancer is the #2 cause of death and consistently shows higher mortality in Black populations. Black Americans experience substantially higher diabetes mortality, often estimated at approximately 2 times higher than white Americans. And much of the early mortality and the disparities could be prevented with better access to quality information, care, and community support. I am heartened to see this panel highlight the urgency of this critical topic and offer its expertise to support the health of our communities. And this panel reflects the very best of what the Divine Nine has always been: service in action. Among our esteemed panelists, I must take a moment of personal pride to acknowledge the 5 physicians on today's panel who are Morehouse men. Our moderator today, Dr. Frank Jones, as well as Dr. William Norris, Dr. Charlie Rouse, Dr. M.J. Collier, and Dr. Willie Underwood III, the newly installed president of the American Medical Association. I also want to acknowledge my brothers of Omega Psi Phi Fraternity Incorporated, and I specifically want to thank the Delta Mu Mu chapter for partnering with the nonprofit Commitment to Excellence to create space for this important conversation. To every panelist, every organizer, and every person in this room who chose to show up today, well done and thank you. I trust that you will have an enlightening discussion that will help to accelerate the work that you do every day and that we must support collectively to improve health and equity in our communities. Thank you and God bless.